I'd like to mention, start first with high cholesterol, and it's called hypercholesterolemia. We all talk about the bad cholesterol, which is the LDL, they call it low density lipoprotein, and there's also some different breakdowns and I'm taught when I went through treatment of high cholesterol and through that module. A great speaker out of Vanderbilt, doctor, cardiologist, taught that, and he shows even there's a little a, an LP little a, there's about 5 or 6 breakdowns of your LDL on the size of those. But the smaller the size, the more inflammatory it is. And if I had a diagram, I would tell you, but the easiest thing is like maybe going through this door right here. A horse probably might not could go through that door, but we as a person could go through that door. So say we're small enough we can go through that door, then in our arteries, we got little spaces in all of our arteries, in our cardiac arteries and everything, in our arteries and vessels in our brain. So when you have something really small and for some reason it gets stuck in there and can go through the wall, then it's seen as a foreign object when it goes through the lining of the artery. So that cholesterol is a foreign object, that LDL cholesterol, small cholesterol. And then they have a thing called mast cells, MAST cells, and other cells that start attacking anything foreign in your immune system. And so then it creates an inflammatory response, and it surrounds it, and it builds cholesterol around it, and then calcium around it, that plaque. So that's made to protect from an intruder in a way, but then it's causing all of our heart disease. So the HDL it's high density, but it's also a larger molecule, so it can't get through the wall. So what we want to do is have supplements that would increase your HDL, and so to make your cholesterol larger, so it can't get through the wall, so it doesn't cause arteriosclerosis. So a lot of people I'm seeing have their HDL, their good cholesterol, too low. So there's things like niacin, which is a B9 if people want to know that, but niacin is really good at increasing the size of the cholesterol particle. Omega-3s are really good at increasing the size. And vitamin D, adding magnesium, vitamin D, some of those are my primary things I do to help lower cholesterol and raise the good cholesterol and lower the bad cholesterol. Understanding how these supplements work are important, and I have a thing here of nutrients. These are about all your vitamins and all your minerals, including CoQ10, which you've heard a lot about, but I remember coenzyme Q10 when I was learning the Krebs cycle back in medical school years ago. If you're the old school doctor, then we were always having to learn the Krebs cycle, which is kind of your cycle of life, your major cycle your body has to go through to make things, to burn ATP, to create energy. And coenzyme Q10 was a part of that. I didn't understand it back at the time, but I understand a whole lot more now. And then you have this homocysteine circle here, and you have a folic acid synthesis here, and everything breaks off the Krebs cycle. So I took 40 hours in biology in school, though how I ended up being psychiatry, I don't know. But I had, luckily, I'm not really, I feel, a brilliant guy, but I was able to make all A's in all my biology courses. I just love biology because it makes sense to how things work, in chemistry and math. And chemistry came pretty easy for me too. What I like to do is teach people about selenium and magnesium and carnitine, what it does, and acetylcysteine, alpha lipoic acid, copper, zinc, and it has a little handout that tells them what they do and then what foods to eat. So you don't have to do a lot of supplementation, you just eat the right foods. I probably went that a little fast, but it's pretty small, so you probably can't see that in the camera. But I do this in micronutrient testing. I test for all these type things by drawing some two big tubes of blood, and I can send it off. So when I get somebody I can't get well, and I got to start doing more testing to figure out what's going on. This is a steroidogenic pathway, or how your body makes your steroids, which includes your testosterone. And so I show this to every man that I start on testosterone, and how it's made from cholesterol. All your hormones, including aldosterone and cortisol, come from cholesterol. So we're here giving anti-cholesterol drugs, and sometimes people's cholesterol is too low. And I was taught you don't want to go below 140. You need 140 cholesterol in order to make all your hormones correctly. So that includes both your estrogens, all three of your estrogens. There's estrone, estradiol, and estriol, and your progesterone, making your cortisol and your hydrocortisone, and so your aldosterone, which is made from the kidneys to hold your salt and water. And we talked somewhat about that, how stress affects that and why you want to crave salt. So, but I give it out and teach people, try not to overwhelm them, and they have little enzymes, and you can go back if you have enough money and time to find out where the breakdown is. If you're not making DHEA, if everybody's heard DHEA or androstenedione or pregnenolone. So I do a lot of handouts, and those are all no extra charge. I just do it, and I have a whole section of things there on my desk of handouts for every mineral and material and things that I do and where they can get it. This is a more detailed, to really get down to it, trying to learn that steroidogenic pathway, goes over all the enzymes that are in there and discusses it. So that's just a cleaner picture, because I tend to overwhelm people, according to some of my people that sit in with me. So, but you get excited about things you're excited about. And this is something I made simple for the signs and symptoms of hormone imbalance, and made it kind of big form, So it goes over signs and symptoms of hormone imbalance. So you got, it says go left to right: depression, fatigue, poor concentration, hot flashes, breast tenderness, insomnia, anxiety, a painful menses, irregular bleeding, irritability, hair loss, fibroids, cholestasis, weight gain, decreased libido, breast and uterine cancer. So it's amazing when you start seeing all these symptoms come in. There are hormones that are out of whack, and we're not really addressing those, I don't think, like we need to be. So from there, that went on there that talks about estrogen benefits and risk. But I have these handouts to give people, and this talks about how to promote healthy estrogen levels, what to do, and works on metabolism, talking about exercising and stress reduction, taking your omega-3 fatty acids or fish oil, and your diet needs to be high in grains and fibers. So I think education is where I'm headed with people, as well as trying to take the time out to help people to figure out why they're not well. And then on their side, they got to have the guts and the courage to be honest and to try to work with me. There are people that just want to come in and pill, and they don't want to be educated. And I guess for those people that just want a pill to come in and go out, I'm probably not going to be the right doctor for them. But if people want to really get well, and they're willing to do what they need to do to get healthy, and spend the time and some extra dollars, then that's what I'm all about at this stage.